Doctor, let's look at the effects.
Yes.
Effects of recurrent miscarriages to a mother especially.
Recurring miscarriages has a very wide effect, and sometimes it's more challenging than infertility itself.
Really?
Yes. They get a lot of psychological issues, because they blame themselves. Is there something I did wrong? Is there, didn't I feed well? Did I go to a place where I was supposed not to go? Is it witchcraft? Why am I losing pregnancies like this? So these are people who move everywhere.
So apart from the psychosocial effects, how about
the real medical? Yes, health-wise, because each time you get through miscarriage, you are at a risk of getting the complication of that miscarriage. For example, you can bleed. The mother can bleed, or you can get infection. And now, in somebody who has been getting repeated miscarriages, with time they sort of don't pay attention to themselves. I mean, when they get a miscarriage, they get stressed. But why go to the hospital? I've lost the pregnancy anyway, you know. And now they don't get treatment. Maybe they don't get antibiotics in time. They get infection, and that makes things worse. Because the infections can go into the tubes. And by the way, some of these complications are fatal, as in they can kill them. They can kill the person.
Really?
Yes. So it's very important to seek help.
Seek medical help when you're going through it. What are some of the early signs that mothers can look out for to avoid recurrent and warning signs to tell you that I think you're going to have a miscarriage? What are are there some signs that mothers can look out for?
Yeah, so when somebody gets a miscarriage, the ideal thing is in that event, if it's the first pregnancy, which the person is losing, for example, losing pregnancy for the first time, usually the first thing is to deal with the emergency. You deal with the emergency. It may be bleeding, it may be the miscarriage, you clean up. Now, when the mother has recovered, maybe 6 weeks later, she's supposed to come back. And then they're supposed to see, is there any underlying cause? That is the time when they should evaluate in details. Even if it is the first pregnancy, I mean, even if it's the first loss. Now, those things which are like risk factors or things which make them know that maybe I can easily get a recurrent miscarriage will be identified in this time. Yes, so they should be able to have a thorough evaluation. When you get a miscarriage, you get a clean-up, you get treatment. When they tell you 6 weeks, come back, this is the reason. Please go back. Don't take it for granted. Don't say, I have lost the pregnancy and say, okay, I'm not feeling any problem. Please go back. Because this is the time when they will be able to look and see, okay, is there a problem in the womb? They will do a good scan.
So what exactly do they do, doctor? When
they usually do a scan to check if there is a problem in the womb which could have resulted into this. Or is there any complication which resulted from this miscarriage? Sometimes you find the tubes develop some infections and the infections persist. Or some people develop cysts, because when you lose some pregnancies, it ends up leading into formation of cysts.
Thank you. Doctor, if someone gets recurrent pregnancies, are there chances of some particles remaining? Yes,
it is. They are there. Some retained products can remain there. Some products can remain retained, and those can cause complications. We have seen a number of them. Some of them are real parts of the fetus.
Really?
And you find it has hardened up and turned into even hard stuff inside.
So you extract
like bones. Yes, you have to extract them out, because it can stop a person from getting pregnant, or it can cause more miscarriages. Yeah, so mismanagement of a miscarriage is one of the risk factors for continued loss of pregnancies.
Thank you. Thank you so much, Dr. Andabati. And then after a mother's got the recurrent pregnancy, you've treated them, how long should they take before they conceive?
Yeah, that's again a good question. Because it's usually recommended that you need at least 6 months. Yes.
Before you conceive again?
Yes, because in these 6 months, if some of the causes of miscarriage, if there were infections, in the 6 months, some of them would have been treated, or your body has fought them. So it's enough time to recover. And also, in that time, your body has recovered whatever it has lost. If you bled a lot, you have replenished your blood. And so you are back to a normal state of health. So you're ready to carry a pregnancy. But otherwise, if you lost blood or you had a lot of complications in the previous pregnancy, and now you get pregnant very early, you could get another miscarriage. Yeah, so you have to be in a good state of health before you get another pregnancy.
Thank you, Doctor. Yeah.